I'm so excited to go to the party today. Do you want to come?
What party?
The one that we're going to.
No, I'm not going to any parties. You know I can't go to parties.
Come on. Yeah, you can. It's only going to be like 100 people.
100 people? I
Yeah.
can't go to that. I couldn't even go to the party last time and there was only 60 people. I can't go to that.
Why are you worrying so much?
I just can't go, Daddy.
What's the problem? Why can't you come? Come on, man.
You can't tell anyone.
What?
I have anxiety. I can't be in places with a large amount of people. I feel so anxious and I can't even breathe. I can't go to the party.
Come on. Don't overthink it.
I'm not overthinking anything. I really can't go. Just the thought of that many people is giving me anxiety.
But anxiety over what? Why are you excessively worrying for no reason?
Because there's too many people and I can't handle myself around that many people.
Okay, fine. I'll pick you up today at 7, okay?
No.
Come on, Noor. Let's go to the party.
No, I have to go. Bye.
No, Noor! Oh, dang it. I was being so inconsiderate of her feelings. Hello, my name is Letty, and today I'll be discussing Noor's anxiety disorder. Generalized anxiety disorder is an anxiety disorder characterized by excessive, uncontrollable, and mostly useless worry about any event or activity. People may think that feeling anxious once may mean that they have a disorder. However, anxiety is completely different from anxiety disorders because people with anxiety disorders have intense worry and fear about everyday situations, and it occurs almost every day and sometimes needs medication in order to calm them down. As you can see, Noor had a panic attack before entering the party. Maybe she thought they were all going to hate her. Maybe she just excessively worried about it for no reason. However, her anxiety convinced her that there was a reason to worry about it. People with anxiety disorders often face many panic attacks and overthink a lot. Anxiety and panic can interrupt daily activities. They are really hard to control, are out of proportion to the actual event, and they can last a very long time. Sometimes, if someone is experiencing a panic attack, they may go out of breath, especially if they have asthma, then the feeling is much worse. Symptoms can start during the teen years as a child or slowly occur during adulthood. There are many different types of anxiety disorders, such as generalized anxiety disorder, social anxiety disorder, separation anxiety disorder, and many more. In Noor's case, she has GAD, which is generalized anxiety disorder. Sometimes anxiety results from a medical condition that needs treatment. Noor takes medication because her anxiety is really strong. The symptoms include excessive worrying. The worrying that is associated with anxiety disorder is disproportionate to the events that trigger it, and it typically occurs to normal everyday events, as mentioned. In order to be diagnosed, the worrying should be difficult to control and should happen almost every day for around 6 months. Another symptom is difficulty falling asleep. Restlessness alone isn't strong enough to diagnose anxiety. However, it is a common symptom, and if it occurs daily, then it should be something that is checked out. Also, being easily startled and scared from anything is a common consequence of anxiety. There are other symptoms such as fatigue, difficulty concentrating, easily irritated, feeling out of breath, and panic attacks, obviously. There are many ways in which psychologists can diagnose someone with anxiety. Since it is not something that is extremely harmful to the brain or person, although it can be severe, there is no need for brain scans unless the anxiety leads to something else. In order to get tested, some doctors say you should do a physical exam to look for signs that your anxiety might be linked to medications or any underlying medical condition. Also, you can order blood or urine tests if a medical condition is suspected. And also talk to your doctor and ask questions about symptoms or medical history. And as well, use psychological questionnaires to help determine a diagnosis. Some technologies like PET imaging and functional MRI can measure the activity of the brain either at rest or while a person does some tasks. However, GAD can be difficult to diagnose. In some cases, it can also be difficult to distinguish it from other mental health conditions such as depression. Some of the main causes of anxiety are a family history of anxiety, meaning it is genetic, recent or exposure to stressful situations, including personal or family illnesses, as well as excessive use of drugs such as caffeine or tobacco, which can make anxiety worse. also some things that happen in your childhood or PTSD, such as childhood abuse. So these are some of the main symptoms and causes of general anxiety disorder. Now Noor will talk more about the biological causes about it. Thank you.
You must be wondering what caused Noor to feel the way that she did, and why did this trigger a panic attack? Many doctors and scientists have studied cases of general anxiety disorder, which is also known as GAD, and what triggers these anxiety attacks in the brain. Well, this is how it occurs, and I'm here to tell you. For people that struggle with anxiety disorder, scientists used to believe that the only trigger for this feeling was the hyperactive amygdala. Then, they recently discovered that this anxious feeling is triggered by the various parts of the brain acting up all at the same time, including the amygdala. The frontal lobe of our brain consists of all of one's cognitive skills. This is where all the sensations and thoughts meet together, while in the limbic system of our brain, that's where the amygdala is located, and this is where all our feelings and emotions are triggered as well. Now, anxiety occurs when the process of the limbic system overpowers our cognitive skills, making our thoughts mainly emotional, causing the amygdala, as well as other parts of the limbic system, to hyperactivate. Noor also could have inherited this disorder from her parents, and many studies support that anxiety disorders are hereditary, like the one that I will explain to you right now. Scientists have stated the following about the three brain regions which they found a trend in inherited anxiety. The first was the orbital frontal cortex, which sits behind the forehead and is the most evolutionary and advanced part of the brain, Callan said. The next was the amygdala, an almond-shaped region deep in the middle of the brain that is involved in fear and emotion. The third was the limbic system, which sits at the very base of the brain stream and is a part of the most primitive reptile brain. Now, Nikolai and Joe will be telling us more about these brain activities and these trends in anxiety disorders with case studies that they have found.
Thank you, Noor. This is an example of a case study. And so many people have anxiety when it comes to going places. An example of that is Mrs. Ian L. Mrs. Ian L. is a 91-year-old woman who, as well as Noor, also suffers from anxiety. She had a case study done on her, and it showcased that people from varying age ranges suffer from anxiety. And she had a specific fear called agoraphobia. This means that she had a fear of leaving her house, and she believed that something bad could have happened to her and increased her risk of dying. An instance of how it affected her was when she doesn't leave her bed at all, and one day she called her husband, who was also of an older age, and he took a little longer to respond. That's when her agoraphobia kicked in. Her agoraphobia was at such a level that where she called the police from her bed straight away without checking what had happened. And even though that they're in the same house as her husband, her anxiety kicked in so much that straight away she called the police and didn't check what happened. And this case study could possibly give us an insight into how Noor might be as she gets older. Her anxiety in the future can not only prevent her from attending parties or feel uncomfortable at social events, but even stop her from leaving her house and her comfort zones. Anxiety can be caused by traumatic events, which could later have a knock-on effect in your life. Mrs. Ian L's treatment consisted of regular checkups for 3 years, which ultimately led to an improvement of her well-being and resulted in no relapses. Noor's best case of treatment right now would be see a specialist as regularly as possible, and it should work as her anxiety isn't as severe and could be eradicated. Thank you. That was my part, and now on to Joe.
Thank you, Dr. Nikolai. My name is Dr. Joe Asad, and today I will be conducting the second psychological case study surrounding our topic of anxiety. So this case study determines how anxiety amongst people with high amounts of work and stress in their environment can be reduced, prevented, and maybe even treated. This helps people understand that even though they might have anxiety and a stressful environment, they can still recover and eliminate it. So this case study was conducted by Isfahan University to test if anxiety aggravates psychological distress and reduces the motivation amongst medical graduate students. The aim of this study is to identify if psychological intervention for test anxiety reduces the level of psychological distress, motivation, and if it increases the intrinsic and extrinsic motivation among medical students. So this study began by pulling 436 first-year medical students and testing them for test anxiety. Out of 436 students, 74 had anxiety. So therefore, later on in the study, those 74 students were split into a waiting group and an experimental group. 32 participants from the experimental group received 5 sessions of psychological intervention, which consisted of psychoeducation, relaxation therapy, and systematic desensitization. So the other 33 students from the waiting list received 1 session of advice and suggestions. The conclusion of this case study determined that after receiving multiple psychological interventions and psychological help, participants from the experimental group experienced less anxiety, psychological distress, and had higher intrinsic and extrinsic motivation in their post-assessment scores in comparison to their pre-assessment scores, rather than the waiting list group, which received 1 session of psychological intervention and received the same amounts of stress and anxiety in their pre-assessment scores as they did in their post-assessment scores. Ultimately, the final conclusion of this case study leads for us to believe that receiving psychological help when having anxiety can help reduce anxiety and treat it. Thank you.